I would recommend it for anybody, really. So thank you, William, so much. William is one of our dedicated dancers. I suppose the strongest message, or one of the strongest messages that we have in arts care, is really our performance message, where people are coming together to dance. Not that I would be biased towards any other art form or anything, but there is something about dance that really tells the story of life in the moment and living through connection. So I'm really delighted to be here this morning. Thank you so much for inviting me. I'm delighted to meet representatives from Turkey. I know Pia Strampman. I don't know if you know Pia very well, from Helsinki, and I have been over there several times and I've met other colleagues from Turkey, so it's nice to see you here in Belfast. I'm going to tell you a little bit when I gather my breath. I've just over a cold. It's not that I'm unfit. So it's unfolding the arts in healthcare. Arts Care is now in its 25th year celebration, which is fantastic, fantastic news. We were started in 1991 by the Department of Health here in Northern Ireland, a very unusual and unique organisation with the sole purpose of delivering the arts into healthcare for enhancing the health and well-being of patients, or service users as we call them here in Northern Ireland, and the staff who care for them and the visitors. Now, I think way back in 1991, there must have been some amazing person sitting up in Stormont who came up with this wonderful model that is a regional model and really stands quite uniquely across Northern Ireland and internationally. So just here, Arts Care supports the development and sustaining of the culture of arts in healthcare across the 5 health and social care trusts. Now, in Northern Ireland, most of you do realise that we do have 5 health and social care trusts, but over 25 years to sustain the arts on a daily basis in a healthcare environment with the intention of delivering health and well-being is actually a big ask for a small organisation that has a team of artists and clown doctors, and then a central regional arts care office here in Belfast. I come myself from a health background originally and left to follow my passion for dance. So therefore the cultures of the arts and, thank you so much. We need an infusion really, a drip infusion I think. I'll take my drink here. From the arts and healthcare, I know the environment very well. Now, a lot of people will say that the arts and health maybe don't come together very naturally, but I actually think they do. Having worked as a radiographer for a number of years and lectured in healthcare, what I found was that most of my colleagues were actually extremely creative people, and that healthcare in particular was full of creativity, but there just didn't seem to be a channel within their working day or within the patient's experience of healthcare to experience their creativity and use that creativity to really enhance their well-being. So at this point, I'd like to say that I agree totally with Adam Turkington, who I have great respect for, in that the autonomy of the artist has to be honoured at the outset if we are intending the impact of arts and health to really be authentic. I know that because, as I say, I come from 2 sides really, from the healthcare and from the arts. The creative process is a very powerful process, and it's one that is really untapped in terms of our life in general. But when you tap into it, whether you tap into it in a dementia ward, in a brain injury ward, in a staff room, healthcare staff room, or you reach into it in learning disability, you will find that the creative process is actually one of the biggest informants in terms of health and well-being. Now, what do I mean by that? Well, I mean that whenever you work with a group of professional artists and you bring them into your city, or you bring them in my case, into a healthcare environment, you must give them the autonomy to do what they know best to do. And sometimes I think the big challenge to arts and health currently internationally is that it has become quite well known. The benefits are, yes, we can see some of the benefits, but what we're losing a little bit of is that risk-taking in the arts. The biggest, I suppose, challenge and constraint to the arts could be that we are trying to make artists into healthcare workers. We are trying to develop a brand of arts and healthcare that might just lay very comfortably with our public sector funders. And I think when you start to do that, you are going to lose a huge essence of what the arts and healthcare really are, and what that essence is in terms of health and well-being and healthy cities. I suppose I left healthcare because I wanted to be an artist or a dancer. So when I became a dancer in healthcare, I knew that I wanted to start dance companies. I knew that I wanted to dance on wards. I knew that I wanted other people to dance in dementia units. I didn't want to go in there to be, now from our perspective, a dance therapist. Dance therapy and art therapy are very different from the model that arts care. So this is a social model of engagement that we have in healthcare. And that means that really our artists are going in there with no clinical intentions. So that's just a little bit about what we do. And again, I don't know, I always seem to have lots of dance photographs. So the idea is that we engage creatively with our service users, our staff and our visitors. We have a team of artists in residence across Northern Ireland. We have 18 artists in residence from different arts backgrounds. We have numerous project artists, and those project artists are now feeding in more positively, I think, and more directly into our healthcare services, supporting our artists in residence, as there are an increasing request for arts to come into healthcare environments across Northern Ireland. So we have a team of 80 project artists from music, digital art, poetry, creative writing, who are working across Northern Ireland in healthcare settings and community care settings. And this is where we deliver into some of the services that we deliver into. But more and more we are finding that we are linking in to healthy cities, we are linking into councils, and we are really bringing the arts that is emerging from the healthcare model is beginning to spill onto the streets. And that is very exciting, because for me, what I wanted at the outset of whenever I started to deliver my practice in health was that really in many ways that arts and health would really come from the essence of our hospitals, our units, that it wouldn't be coming from the streets, and that we would have some of the most exciting artists in the world working in our environments, going in on a daily basis into our dementia units, knocking the door, waiting for those doors sometimes to open because they're actually, they have to be secure and they are closed. There are lots and lots of journeys that the artist makes to get into healthcare. And I'll have to go here with the glasses. Then the vibrant programmes of activities that we have. As I say, Belfast Trust has 3 dance companies. We have another dance company that has just emerged out of a programme that we've been doing down in Derry City called Strabane, and now into Derry City, Let the Dance Begin. And that's a new development for Arts Care, where we're moving in to create a healthy town from the service users and the most vulnerable in the town. And we're listening to the most vulnerable people, the older people, the people with disabilities, the ethnic minorities, the children, and we're saying, what do you want? What do you want? And I was so delighted to hear Joanne talk about the dreams, making dreams. We do a lot of work with children in care, and it's not the children in care that have lost their dreams, but a lot of the people who are caring for the children have lost their dreams. And we did a lovely project where on camera, where the children were doing an interview kind of technique with each other, and it was In Your Wildest Dream was the actual title. And whenever we asked, or the children asked their social workers, what is your dreams? What are your dreams for the future? One of the social workers says, well, I'm laden down with a wife, I'm laden down with the wains. Equivalent of wains mean children in sort of Northern Irish term. I don't have any dreams anymore. So people are really living life at a pace where actually their dreams are disappearing, and they're in the situation where they're caring and supporting others. So we can support and we can give motivation to staff through our arts activities with staff and staff organisations within healthcare as well, just supporting the staff as much as supporting the service users with a variety of projects. So here we have, again, Orbit Dance Company, Black Widows Dance Company, a staff choir at the Belfast Trust. Here now, Older People's Arts Festival, which reaches right across, that's for well and unwell people, right across Northern Ireland, with an outreach of thousands of people. Twilight Zone is our looked after children's project, and then regular exhibitions on our Arts Care Gallery. To date, we have across Northern Ireland 7 Arts Care galleries, and one of the nicest galleries that I have ever visited from an international perspective in a hospital was a gallery in Helsinki, actually. I can't remember the name of the hospital, but I was really struck. It was very simplistic. It was big wooden, fabulous sculptures, and you found them on every level of the hospital. And I thought, how important are the arts in terms of our environment, in terms of changing and giving cared for spaces, and really celebrating health and well-being through authentic culture. Just let me know whenever, the time-wise, just because I could go on. This is our Clown Doctor programme, and I know there are European clown doctors. It is an international method, and our clown doctors on a weekly basis go into children's hospitals, into respite care, and into hospice care as well. And we have now strategically driven a new programme for children, the most vulnerable and sick children and young people here in Northern Ireland, called the Cartwheel 999 programme, and we are opening the first ever regional art gallery in the Royal Hospital, Children's Sick Hospital, in the beginning of April. And that's just to showcase all the fabulous artwork that the sick children, some with life-limiting illnesses, whose voices maybe are not as strong as they would like their voices to be, and to use this fabulous art gallery space up on the Royal site as their space, and it will be a regional space, working with our arts care artists to create fabulous art exhibitions. So if you're in the Children's Hospital and you're going down a corridor near the MRI from the second week in April onwards, you will see a lovely new arts gallery. Why are the arts so critical in healthcare, and how can we then translate that into better community? Well, I think the debate has to be always in the dialogue around the right of the person to access quality arts, no matter where you are, whether you're living in your village, your town, whether you're at home and you're isolated, or whether you're in school, whether you're in the supermarket, whether you're in the police station, whether you are in hospital. Arts and culture should be really embedded into our whole identity. And when you begin to unfold your personal creativity, and this is one of the things that's most exciting for us here in Arts Care. We do a lot of work with service users and patients, but the most exciting way forward, I think, into a creative culture in healthcare that will be sustainable is the unfolding of the staff's creativity. If you're in a theatre and you're working with a surgeon, as you look at that surgeon's hand, I used to go in for hip operations, whenever I was a radiographer, and I was really intrigued by the beautiful hands of the surgeon who was sculpting, who was there using his creativity. But when you spoke to them, they would say, well, actually, no, I'm not creative. I won't be getting involved in any of your arts. Whenever you watch a nurse who is in a unit working with someone with a brain injury, and you look at the sensitivity and the way in which they almost duet in their care practice, for me, it is a dance of humanity. And it's just really, the artist can liberate this, the artist can identify this, and the artist can support it. But the artists need to be supported within that environment too. And I suppose for us, one of the biggest challenges, as for all arts organisations, is that our funding usually comes on an annual basis. And I love the idea of a 10-year strategy. I was talking to one of the most successful businessmen here in Northern Ireland, a really nice gentleman, not that long ago, and he's in his 80s. So I said, what is the secret of your success, and what would you dream for? And he said, I dream for 100-year strategy. And I thought, how fabulous. 80 years old, successful businessman, and his sight is 100 years down the line. It's not 1 year, it's not 2 years or 3 years as our funding comes, it's 100 years. What freedom would we have if actually, even as artists, we were given 10 years of trust to actually let us get on with the job that our artists know best to do, and give them the freedom that they so much need to deliver fabulous services in healthcare, and spilling that into our community. I think they are really undervalued, our artists. I value every single artist that works for Arts Care, because they are there because they have a passion for the work, they have a vocation for the work, they are there because they are building sustainable relationships, and they are working at the rock face. Why did I choose to take my arts into healthcare? Because I think it's the most exciting part of life, where people are their most vulnerable, where they are the strongest, where they are ready to articulate, and where we need to support each other. And that's where the arts, I think, become vibrant, exciting, and meaningful and purposeful. So I'm just going to go really towards, skip through all of that to this last little one here. And that is a child. That is a lot of intergenerational work that we do. And this is an intergenerational piece. And there is something about this photograph that draws me back time and time again. These are the faces of our children of the future. Let's now unfold their health and well-being by really supporting authentic arts. And let's invest in every sense with our artists in our society. Thank you so much.